Welcome students to our new YouTube channel Pharma Extech, the division of excellence. So we start with the antihypertensive drugs. In that we first see the direct vasodilators. So the next we see the calcium channel blockers. So let's start to this calcium channel blockers. So these calcium channel blockers include the cardiac effects. In that there is a decrease the contractility, that means negative inotropy, and also the decreased heart rate, that means negative chronotropy, and also the decreased conduction velocity, that means negative dromotropy, and also the vascular effects like smooth muscle relaxation, that means vasodilation. Then next we see the mechanism of action of calcium channel blockers, and the mechanism of action is these calcium channel blockers inhibits the passage of calcium through the voltage gated L type for large or long lasting current calcium channels on vascular smooth muscle cells and cardiac myocytes, and reducing the calcium availability by muscle contraction. And note that an inhibitor of the T type, that means transient current of cardiac calcium channel, that means mifradil, this mifradil has recently been terminated due to unacceptable drug interactions. So in GPAD there is a question that which drug has been recently been terminated due to unacceptable drug interactions in calcium channel blocker, and the right answer is mifradil. And also in ion channel blockades explains the observed in peripheral vasodilation and also in negative inotropic and negative chronotropic effects. So next we see the adverse effects. Of these calcium channel blockers, and the adverse effects like flushing, headache, palpitations, in that reflecting the reflex tachycardia in response to vasodilation, and also the may worsen heart failure due to their negative inotropic effects. These are the adverse effects of calcium channel blockers. So next we see the some therapeutical indications of calcium channel blockers, and this includes hypertension and angina. So hypertension, this is by causing the vascular smooth muscle relaxation, and also this calcium channel blockers decreases the systemic vascular resistance, which lowers the arterial blood pressure. These drugs primarily affect the arterial resistance vessels with only the minimal effect on venous capacitance vessels. Then next therapeutic indication is angina. So this angina we see the drugs, anti-anginal drugs. So this angina. So in anti-anginal drugs we see this anti-anginal drug are used in the treatment of angina pectoris. So this angina. So in the angina there is the anti-anginal effects of calcium channel blockers are derived from their vasodilator and cardiodepressant actions, and also the systemic vasodilation reduces the arterial pressure, and which reduces the ventricular afterload, that means wall stress, and thereby decreasing the oxygen demand. And the more cardioselective calcium channel blockers like verapamil and dieletazine decreases the heart rate and contractility, which leads to a reduction in myocardial oxygen demand, and which makes them excellent anti-anginal drugs. So these verapamil and dieletazine are more cardioselective calcium channel blockers used to decrease the heart rate and contractility, which leads to a reduction in myocardial oxygen demand, which makes them excellent anti-anginal drugs. and the calcium channel blockers can also dilate the coronary arteries, and they prevent or reverse the coronary vasospasma as occurs in Prinzmetal's variant angina, and thereby increasing the oxygen supply to the myocardium. Then the third is arrhythmias. That means we see these in antiarrhythmic drugs. So the antiarrhythmic properties, that means in class 4 antiarrhythmics of calcium channel blockers are related to their ability to decrease the firing rate of the aberrant pacemakers site within the heart, but more importantly are related to their ability to decrease the conduction velocity and prolong the repolarization, especially at the atrioventricular node. This latter action at the atrioventricular node helps to block the re-entry mechanisms which can cause by supraventricular tachycardia. So the re-entry mechanisms can cause the supraventricular tachycardia. So next we see the some different classes of calcium channel blockers. So in that there are three classes of calcium channel blockers. They differ not only in their basic chemical structure but also in their relative selective towards cardiac versus vascular L-type calcium channels, and also in that the most smooth muscle selective class of calcium channel blockers are the dihydropyradines. Because of their high vascular selectivity, these drugs are primarily used to reduce the systemic vascular resistance and arterial pressure, and therefore they are primarily used to treat the hypertension. And these drugs are not, however, generally used to treat angina because their powerful systematic vasodilator and pressure lowering effects can lead to reflex cardiac stimulation, that means tachycardia, and increase inotropy, which can dramatically increase the myocardial oxygen demand. So next we see the non-dihydropyradines, and the examples of non-dihydropyradines including the verapamil and dieletazine. So this verapamil is phenylalkylamine class. So in GPAT there is a question, the class of drug verapamil, and the right answer is phenylalkylamine. And this verapamil is relatively selective for the myocardium and is less effective as a systemic vasodilator drug, and this verapamil has a very important role in treating angina by reducing the myocardial oxygen demand and reversing the coronary vasospasma and arrhythmias. And the next drug is dieletazine, and this dieletazine is benzothiazepine class. So also in the pair there is a question, the class of drug dieletazine is, and the right answer is benzothiazepine. So this dieletazine is intermediate between verapamil and dihydropyridines, and in its selectivity for vascular calcium channels by having both cardiac depressants and vasodilators actions, and dieletazine is able to reduce the arterial pressure without producing the same degree of reflex cardiac stimulation caused by dihydropyridines.